Hello everyone, welcome to Wisdom for Exploits with me, Bola Amure. Today I have another amazing lady with me. She is a medical doctor. Before I introduce my guest, please remember to subscribe to our channel and press the notification bell. Thank you. Yes, I'm going to introduce my wonderful guest. Her name is Dr. Ebun Carew. She is an experienced general practitioner with a strong foundation in clinical care, academic contribution, and health communication. As a GP, educator, and research contributor, she is committed to training the next generation of doctors with a particular interest in health awareness and women's health. Driven by a deep passion for helping individuals prioritize their well-being, Dr. Carew encourages people to live in alignment with their God-given purpose. Outside of her medical work, she is a dedicated leader in her church youth ministry and serves as a mentor to young women, offering guidance and inspiration both in faith and life. Welcome today, Dr. Ebun Carew. Nice to have you on this talk show.
Thank you so much for inviting me. It's an honor to be a guest on here. Thank you.
Yeah, you're welcome. Welcome. So today we're going to be discussing women's health issues, a call to action. And my first question to you, Dr. Ebun, why did you choose medical line as your field of practice or expertise?
Okay, so why I picked medicine?
Yeah.
I've always had an interest in science and in helping people, and I wasn't really sure what direction I wanted to go in. And at one point I had an obsession with eyes, believe it or not. So I thought, perhaps I'll go and help people see better. And when I did some experience, I wasn't particularly enthralled by what I saw. And my mum said, the next step up from being an eye specialist might be to be an eye doctor. So I thought, okay, well, I've never considered medicine, so let me go and have a look. And the experience that I had on the wards just piqued my interest. Mm-hmm. And from there, I never looked back. That's how I found my love for medicine, by accident almost.
Wow, that's good. That's really good. Yeah, today we're going to focus on women's health, which is the most important thing, because we know women, they have a lot of issues. I know men do, but today we just want to focus on the women.
That's
so yeah, because when you see women, they say I have this, I have that. If you gather 10 women on the spot, if you can pick about 8 people that will say they have one thing or the other. Absolutely. Yeah, I've come across them and say, I have this, I have that. So what are the causes of, today we're going to focus on so many things. So the first question is, what are the causes of irregular periods in young adults?
Okay. So causes of irregular periods in young people or young females, it varies depending on kind of how old they are. So when you start your periods kind of around that age 10 to 12 mark, it can take a few years for your hormones to settle down completely. So in the first few years, we expect women to have irregular periods, and that's actually completely normal. For some people, that can drag on up until about the age of 16 to 18, depending on when they start their menses, until their body settles into a natural rhythm. So irregular periods initially, when you've just started your periods, isn't completely abnormal. It could just be your body settling down. But as time goes on, kind of what we expect is your period should come every kind of 28 to 35-ish days. And if you are having irregular periods, we think about the hormone fluctuations or changes with your hormones, and that could be problems with your thyroid. We think about, is it a problem with your uterus? You have problems like endometriosis or fibroids. If you are particularly stressed, or you've lost a lot of weight in a short period of time, or you're exercising excessively, that can also cause problems with irregular periods. Pregnancy can also cause problems with irregular periods.
Yeah.
And also other conditions like polycystic ovarian syndrome So it really depends on each individual as to why they might have it. It can start off as normal and then become abnormal or pathological, as we call it. And it could be problems with you and stress and weight changes, or it could be more underlying medical problems that can cause that.
So what about, because when I know I mention young people, sometimes I know most of the ladies start their period, or let me say girls, because some are still in primary school. They
Yeah.
start their period from age 10, which is a bit alarming because when we were growing up, it was a bit later. I don't know. I'll talk for myself because
Yeah.
myself personally, I started my period at the age of 19. I know people say it's too long. No, no, no. I thought a lot of people as well that started at the age of 2021. So I think it depends on individual, body.
Yeah.
So, but the particular age group I'm looking at is from 18 to their 20s.
To their 20s, yeah.
Yeah.
Um,
Yeah, I know you've explained quite a lot of things that it could be maybe the hormones, it could be stress, it could be so many things you did mention, or thyroid as well. But what
yeah.
about if this a particular, let's say, okay, let me pick a particular person now. Let's say if the particular lady, they're having their, what's it called, irregular period. And now they've checked everything, they've done blood tests, they've done scan, and everything is done, and nothing was found. So what could that be? Could it just be a natural stuff?
Oh, I mean, as a woman, you should be getting irregular periods if everything is working normally. So when you say they've checked everything, I'm hoping that means they've checked not just the standard panels of hormones, but we need to look at other problems like having something like a prolactinoma, which is like a small a growth in the brain that can cause problems with hormone fluctuations. So when we check panels for people in terms of looking at primary causes of having irregular periods, then we really need to check quite a lot of different hormones. So something, as I said, like PCOS can affect it, but it can be not just problems with down below, it can be brain problems that can cause those hormone imbalances. So your doctor should do a very, very thorough set of blood tests, and there should always be something found. If there isn't something found, then we start questioning other things like genetic problems. But almost always we find a good reason for why, and it depends on what it is as to what the fix might be. For something like a prolactinoma, it would just be a case of having some medication to help with that.
Okay, thank you very much. Thank you.
No problem.
So the next question is, what factors contribute to fibroids between the
Okay.
age range of 25 to 45 years old?
Okay. So
And
fibroids. Oh yeah, go on.
yeah, okay. Okay, answer the question, because I was thinking that this fibroid, I used to think before people having fibroid is only people that have this big body. But I've come across ladies that are very slim, even more slimmer than I do, and they tell you they have fibroid. So what are the factors that contribute to it?
That contributes. So you'll be very disappointed to hear that we still don't have an actual cause for why people have fibroids.
Wow.
So fibroids themselves are non-cancerous growths in the lining of the womb or the uterus. And there's been a lot of research into why you can get excessive growth of that. We know factors can contribute to it, and especially in the Black community or Black Africans or Black Americans, we know that we're more likely to have fibroids and we're more likely to have them younger. What is the reason for that? Unfortunately, there's not a very clear reason, but we know that some things can contribute to it. So being Black in general is a contributor for high risk of having fibroids. Being obese, like you mentioned, people who are generally bigger are at more risk. And the only link is that I can think of is that the growth of fibroids is linked to hormones. All women have the estrogen and progesterone hormones that do the cyclical changes every month, and we know that those cyclical changes can contribute towards having more fibroids. So if you are obese or you have more fat actually it eventually produces estrogen rather, and estrogen can contribute to the growth of fibroids. So that's why being overweight can contribute to you having fibroids. But yeah, genetics, weight, being Black are the only risk factors really that we know, and apart from hormone exposure, but all women have hormone exposure. So it's a very frustrating answer. There's no real light at the end of that tunnel at the minute in terms of this is the exact cause and this is how to prevent it. But we know generally having a better lifestyle, being slimmer, not smoking, etc., can improve your management of the symptoms, but we can't completely prevent them, unfortunately.
Wow. So fibroid, do you think so? I mean, based on what you said now, so you believe that fibroid, I don't say you believe that's that because it's your profession. So now fibroid is more into like Africa-ish people.
Yes.
What about the Caucasian?
So for reasons, again, unknown, which I know is not very satisfying, we know that Black women are just more likely to have fibroids, and they're more likely to have them younger as well.
Wow.
There must be some sort of genetic underlying reason, the differences between the races, but that reason hasn't been found yet.
Okay, thank you so much.
No
Thank you. What are the causes of cervical cancer? Is it curable?
Okay. So cervical cancer is a abnormal growth of cells on the cervix. The cervix is the end of the uterus where it pokes out into the vaginal. And cervical cancer, as I said, is abnormal growth of that. Causes of that in about 99.7 or something like that, not quite 100%, but very close to 100%, is the presence of the HPV virus, or human papilloma virus. There are over 100 different strains of the human papilloma virus. They're responsible for causing all sorts of things like warts, but specifically they also cause cervical cancer. And HPV is sexually transmitted. So if you have never had any kind of sexual, and it doesn't have to be complete sexual intercourse, if you've never had any kind of sexual encounter with anybody, you're unlikely to have the virus. But as soon as you become sexually active, HPV is extremely prevalent in the sexually active population. And so we know specifically there's some strains of this virus, if and when you do contract it, that are more likely to give you cervical cancer, specifically strains 16 and 18. So in the past, it was a case of attending your smear test. They'll take a lining of the cervix, send it off and have a look. But actually things have changed now. We know that almost nobody who doesn't have the virus actively present won't go on to have cervical cancer. So we test now for the HPV virus. So when you go and have your smear test, they check to see if you've got the virus. If you haven't, they won't do any further tests. But if you do have the virus, then they'll go on to test to see if you're at risk or do have the cancer. So in terms of is it curable, at the minute, pretty much yes, because of the HPV vaccine. So if people get the vaccine, which is on the UK vaccination schedule, about the age of 12 or 13, hopefully because before they become sexually active, we can protect you against those more virulent strains, or the strains that are more likely to cause the cervical cancer. But if you have missed the boat of the vaccines, if you're a bit older or it wasn't available or you didn't have it for whatever reason, then attending your smears is a really good way of trying to prevent you getting cervical cancer. What we want to do is prevention is better than cure. So as soon as we see the abnormal cells, we want to take them away to ensure that they don't continue growing. So in that sense, potentially cervical cancer, we're hoping won't be a cancer that we see very much of in the future because of the reason of the HPV vaccine.
Yeah, thank you very much, Doctor. I want to ask a question. I know when a lady turns 21, is it 21, 20? I can't really remember now. Once you turn 20 or 21, your 21st birthday, they send you a letter to come and do this smear test.
25, yes.
Is it 25 or 21?
Yeah, I believe it's 25, yeah.
Okay. Yeah, because now I received the letter some time ago. So the question now is, if a lady that is in 30, for example, that is still a virgin, and now they say, come and do this smear test. And the lady is so scared and said, okay, because they said it's good to do it so that, if there's anything you detect earlier. How can you advise such a lady that is a virgin, and because they said if they put this thing in me, I'm going to disvirgin, and if I got married, no man is going to believe that I didn't do it. It was through this smear test that got me disvirgin. So how do we encourage such lady in those kind of age group?
Okay, so virginity, I think we have to clarify, isn't just the breaking of the hymen, it's actually engaging in some sort of sexual activity. And if you are a virgin, it can feel very invasive all of a sudden to have a healthcare professional down there trying to take a smear, and it can be, of course, very uncomfortable because that area hasn't been stretched before. And so in my own practice, when I have women who tell me that they are virgins, and there's a need to do a pelvic exam, I question whether I really, really need to do that pelvic exam, because I think it can be incredibly uncomfortable. And only if they are happy to go forward do I then go ahead and do that, and only if it's absolutely necessary and there's no other reason that we can't go, we can't bypass that examination. So for women who are 30 plus, let's say, so you're definitely in that category of needing a smear test. You've never been sexually active at all, and when I say at all, I mean that's kissing or any kind of genital or oral contacts, because we know that HPV can be transmitted orally as well, or anally for people who are into that kind of things. Then I would say actually there's a new testing out now that means that you can do the test at home. You can request from your GP to do the cervical test at home, because as I mentioned earlier, it's just testing for the HPV virus at this point in time. We're not even though we do take smears, we're testing them first for the HPV virus, and if it's abnormal, then we look at the cells and say, oh, okay, this looks like it looks not quite right. So thankfully there is option A, which is still to test yourself anyway, which is you can request a swab that's posted to you at home, and you do that swab yourself, and that will test for the HPV virus. That negates the reason for anything. It's much less invasive. It's the size of a cotton wool, so it's not a speculum or anything else like that. So that would be the ideal option. You request that, still have the test, because you just never quite know where you might have contacted something. Option B would be to ensure that you've had your HPV jab at whatever point in time. So if you've never ever been sexually active, you know that you shouldn't really have the virus. So I would then say go and get your jab to ensure that when eventually you do become sexually active, that you are protected. You can't guarantee what your partner has or hasn't done in the past. Even if they said, oh, it's just a little bit of something here, they might still have contacted it somehow. And it's up to that individual person. For me personally, I waited until after I wasn't a virgin anymore, after I was married, to go and have my smear, because I didn't feel comfortable. But I know that some women, and a lot of women, do feel comfortable to go and have the speculum test. You just need to let whoever your healthcare professional know that I'm a virgin. Please be very, very gentle with me. Use the smallest speculum, use a lot of lubrication, lots of deep breathing, and I would encourage you to also have painkillers beforehand if you want to have it done. But I would say that we would recommend you have it anyway.
Exactly, because I know exactly what you said. I think we had the same experience, because during my own time as well, I got married almost 2 weeks to my 30th birthday. So, and I know they were sending me letters, and I said, I'm not going to do this until I get married. So I didn't do it until I got married. So some people is like, they just want to wait.
Yeah, okay. And I can understand the waiting, as long as they understand that there's always a risk of them having cervical cancer, unfortunately. So, and you have to make an educated decision. You know that the chances of it are small if you are a virgin, but it's not impossible. So if you feel that and especially if you've got no symptoms, you're healthy, there's nothing else worrying you, you can choose to defer it. But the option one, as I said, would be to get the swab at home and do that, and make sure that you definitely don't have the virus. That's easy. It's not very invasive. Thankfully, you no longer have that option of mandating you to go for your smear.
Wow, that's good. Thank you very much for that wonderful advice. Yeah. What are the causes of infertilities, both in newly wedded couples and the old couples? Some people, I know the old couple, maybe they've been there, they had one child, and that's it, they couldn't have any more. And the new wedded couple, let's say some people like us, that we don't know nothing until we get married. And some people are in that category whereby they waited for years and they say, oh God, I'm a virgin, I got married. Why am I not having kids? What's going on with me? So, what are the causes of it?
So infertility is officially defined as trying for a period of about 2 years and not getting pregnant. So before that 2-year mark, we don't class it as being infertile.
Mm.
After 2 years or more of trying, and we say when you're trying, it means you're having regular intercourse, vaginal intercourse in your fertile window, which means when you're ovulating, so about day 12 to 15 of your cycle or thereabouts, regularly in those time periods, and you're still not getting pregnant, then we then say you have infertility. So when you say someone who has never had a child before, that we will call primary infertility. Someone who has had a child before and is struggling to have a second one, that would be secondary infertility. And there can be various reasons for that. So it can be factors to do with the woman, it can be factors to do with the man. So with the woman, we always ask, as we were talking earlier about periods, are you having regular periods? And you'd be surprised to know whether or not some people say, well, actually it's once every 3 months or something like that, or once every 4 or 5 months. That's not a regular period. We're expecting it about every month. So if they're not having regular periods, that's always, of course, for concern to see what's going on there. And then, especially with women, still staying on women, we then think, okay, have you got any health conditions that will stop the egg from being released, the egg from traveling down the fallopian tube, the egg from implanting in the womb, and you carrying the pregnancy later on? So if the eggs aren't being released in the first place, you could have, unfortunately, primary ovarian failure, which is where essentially the ovaries aren't working and releasing any eggs. And that's anybody under the age of 40, or premature ovarian failure. Then if you've ever had a problem with like an infection down below in the pelvis area, and that's affected the fallopian tube. So if someone has been sexually active, for example, in the past, and they had an infection, it wasn't treated or it was treated late, that can cause scarring in the tubes, and that can cause infertility that way. If you've got problems with fibroids or endometriosis is growth of the lining of the womb in the wrong places, that can also hinder fertility as well. So those, in addition to all the things we discussed, that can cause problems with irregular periods. So that's the diabetes, the thyroid problems, PCOS, or primary polycystic ovarian syndrome. Sorry, I don't know if I'm talking too quick.
No, yeah, go on. Yeah, I'm getting it. Yeah.
So that those are most of the things that we consider for the woman, but general and for both sexes, general things like not being overweight, not smoking, alcohol, exercising regularly, all of those contribute to having better fertility. And especially for women and men actually who are struggling with fertility, a lot of IVF clinics and things won't accept you if you have a high BMI, if you're drinking or smoking and all these other things, because we know it can affect your overall health and fertility. And moving on to the men, we can then problems that can cause it would be having a low sperm count, having even if you do have normal sperm count, having sperm that aren't moving very well or aren't formed properly for whatever reason, or having, for example, if they've had surgery as a child and it means that they've lost a testicle or something, or they've had an infection as a child and it's caused scarring in the testicles, or in the tubes that carry the sperm out. That can also cause problems with infertility as well. So those are causes of primary and secondary infertility, because at any point in time, a woman or a man can develop an infection that scars any part of their reproductive system, even if you've had a child before. So that can sometimes cause secondary infertility. But we know it tends to be for people who have secondary infertility. It's a lot of things, especially for women. You can start going through the menopause from about age 40 onwards. Some women can start going through the menopause, and that can cause irregular release of the eggs, and that can cause problems in terms of getting pregnant. As we get older, we tend to put on a bit more weight, as I mentioned earlier, so that can sometimes affect things as well. But then we look at other conditions, diabetes, thyroid problems. Like it's a whole. As we get older, all of these things are more likely to happen. So it's a combination of other things, and also because you're more likely to be unwell as you're older. Problems with medications that people can take can sometimes affect their fertility as well, and sometimes you don't think it will, but actually they can do. And even if you were, for example, for women now, on a form of contraception, something like the depot injection, that can delay your fertility returning back for almost up to 2 years. It doesn't, for some women, they go back completely, but for a lot of women, it can take kind of a year to 2 years for fertility to return back to complete normal. So being careful, especially if you're just getting married, about the type of contraception you're having, checking how long it takes for that effect to stop in the body is also important.
Wow. But what about people that don't like this contraceptive and they just, I've seen a woman that say, I don't take none of it, no injection, not even the, what's it called, Marie coil or whatever the
The
coils and all.
marina coil,
Yeah.
yeah.
Yeah. So, and she's fine, even though she's not having babies anymore. But what about people that doesn't want to go through that direction?
In terms of contraception.
Yeah.
So, I mean, there's a lot of different options of contraception. The only option for men is condoms. And the options for women is a bit more, but we know that some women unfortunately can react to the different types of hormones. So you can either have non-hormonal or hormonal types of contraception. So thinking about non-hormonal, it's the female condom, not very popular, but it's still an option. And then the copper coil, which sits in the lining of the womb, and that lasts for 5 years, 5 or 10 years actually, depending on which one you get. So if you don't want any hormones in your body, you choose to use a female condom, or you can have the copper coil. The other option for a low hormone option would be the Mirena coil. It releases a very small level of the progesterone hormone into the lining of the womb. Then we move into the hormonal versions, which would be the combined pill, the mini pill, the implant, the depot. And it depends on whether or not you're good at remembering things. So if you're someone that really doesn't remember to take a pill every day, then ideally you should
That one is in trouble.
Yeah, exactly. So you should be thinking, perhaps I should go for an implant, a depot, a coil, either merino or copper coil. Or if you're better, so for example, something like a patch, there's a contraceptive patch that is every week, or the vaginal ring, which is, again, you have to change every week. But I think people really need to sit down and decide what is best for them. If you're someone that can't remember to take things every day, I wouldn't recommend a pill.
To go on the pill, yeah.
Yeah.
And some people use lemon water.
Okay.
Yeah.
And I assuming they're drinking the lemon water.
Yeah, they drink the lemon water as soon as they have intercourse. So that's their only contraceptive. Contraception.
As a doctor, I couldn't recommend that as a form of contraception, especially if you're really, really trying to not get pregnant. I would not recommend that you do that. There's always lots of folk tales about this works and this works, and of course you could do the abstinence method, which is where you track your cycles and you abstain from having intercourse on your fertile days. The only issue with that is that sperm can live in the vaginal tract for 5 to 7 days. So actually, if you've got to be really, really careful and know what your cycle is like and be really diligent at checking your temperature, but it's slightly higher risk. I would always say have some form of reliable contraception. At the very basic, have condoms. But ideally, if you're serious about not having children, I would really consider people to look at other more tested and tried methods, because something like the implant, it stays in for 3 years. It's 99.7% effective at preventing pregnancies. So it's what we don't want is people in difficult situations and having to make difficult decisions because they found themselves in a pregnancy that they didn't want. And I should also remember to mention actually that once you've had your family, once you've had the children, you can also go and get a vasectomy or your tubes tied. Vasectomy for men, very effective. It's about a 20-minute procedure, very safe. Or having a tubal ligation is a more invasive procedure. It also fails more than a vasectomy, but I would encourage women to encourage their men to get vasectomies once they've completed their family.
The majority of men want to go through that one.
It's true, but education can hopefully enlighten them.
Yes, it's true. Thank you for that. Thank you so much. Yeah. What is the most effective way to support young ladies in having and keeping good menstrual health and hygiene. Some treat their period without proper attention, so they use different kind of sanitary pad and all those stuff. So how can we support them to keep a good menstrual hygiene?
Okay. So when you're on your period, it's a very normal and natural thing. And I think sometimes there's a lot of shame that comes with being on your period, and people are trying to hide it. And we really should be taking that away. This is how life is. This is how women are made. We have periods. There's nothing embarrassing about it. And I think encouraging women to think of it as a very normal thing is the first thing, and not have any kind of shame or any problems associated with having a period. When you're on your period, you should be trying to rest as much as you possibly can. And I know in this kind of busy world, it's difficult because it takes a lot from the body. But ensuring that you have access to running water, so you can go, you know, change your periods, your pads. So pick which one you want to use. Number one, are you going to use pads? Are you going to use tampons? Are you going to use a menstrual cup? Because there's different options that you can use to maintain your periods, and ensuring that you change them regularly. Women get into problems, and can even to life-threatening problems, something like toxic shock syndrome, if they leave their tampons in for too long. Ensuring that you are changing them often. As you grow into having your periods regularly, you will know whether you are a heavy flow or a light flow. And usually, typically through the periods, the first few days are very heavy. You probably need to change things a lot more often. And in the last few days, things are a lot lighter. So some people will start off using, you know, thick, heavy pads in those first few days, and then change to a lighter pad as time goes on. So I wouldn't say you need to have just one product. You can actually mix and match a lot of products in that time period to ensure that you're catering for the needs of your body throughout. Ensuring that you are washing regularly. So blood is sticky, it's messy, you know, ensuring that you're having regular showers. And if ideally, every time you change, if you're at home especially, every time you change your periods or your pad or your tampon or your menstrual cup, you can wash the vaginal area just with water. And when I say wash, I mean just the outside, which is the vulval area, not inside, so which is douching. We encourage people to not use the commercially marketed soaps for cleaning, because the vagina itself is very good at maintaining its own cleanliness, and it has a specific acidity level that it likes to be at. It has a specific moisturized level that it likes to be at. So using products and different things to try and wash inside there, completely say try not to, because it can cause lots of problems. Because people then come, and I treat a lot of women for BV, and it's because they're trying to keep themselves clean, but they're using things that they shouldn't do. So ideally, just wash the outside, just the vulva, with water when you're changing your pads or tampons, and that should be at, you know, every 4 hours or so. You shouldn't be leaving your period products in for 6, 8, even though they say they can stay in for 8 hours. Ideally, you should be changing them 4 to 6 hours. To ensure that you're keeping yourself clean regularly, and if you can, use a wipe or water to wash the outside. Wearing cotton pants is also really important, and I know people like to wear different kinds of fancy underwear, but
I know. I know those stuff.
Yeah, and when you're not on your period, and to be honest, even when you're not on your period, wearing something that's breathable helps to maintain good hygiene in that area. So wearing cotton pants is also really important. But changing often, wearing cotton pants, and also matching the absorption level of your product to your period is also really important, because then you know, accidents and things like that can be easily avoided. But if you're having excessively heavy periods and you think this is a bit much, then always see your GP to get advice for yourself.
Wow, that's a lot. Women, God help us. Yeah, why is it that some ladies have issue with period, especially serious pain when they're having period? You know, some will be rolling on the floor, some they can't go to work. What is the cause?
So periods are uncomfortable, and there's going to be some degree of pain happening, but it can't be excessive amounts. And if every woman knows what their own cutoff level is, we all have different pain thresholds. If it's to the point where you can't walk or you're rolling around on the floor, that's abnormal. You should still be able to function if you're taking a bit of paracetamol, ibuprofen, and just kind of get on. But if it's excessive pain, we start thinking, why? And the most common causes of this are problems with fibroids. So having fibroids,
Oh,
which unfortunately we know that Black women are more likely to have. Because what happens with your period is essentially the uterus or your womb contracts. And every time it contracts, it squeezes out blood. And that's what causes the discomfort, because it squeezes lots of things out. And so having fibroids, because it's the uterus is then very bulky and heavy, and there's
mm,
lots of extra growth where there shouldn't be. Every time it contracts, it causes a lot of pain.
wow.
Having endometriosis or adenomyosis. So endometriosis is where you've got growths of the lining of the womb in the wrong places, and that can be everywhere from the bladder to the cervix. Like, it can be almost anywhere in the pelvic area. So if you're having excessive pain, we then think, have you got one of these problems? And some women, we find no real cause as to why they have that pain, but before I say, oh, this is just a you thing, we then need to make sure that there's no problems. And it is unfortunately often things like fibroids, adenomyosis, endometriosis that are causing those excessive pains. And
Mm,
then thankfully there's ways to treat that. If you are finding that the periods are exceedingly heavy, you can go on some form of hormonal contraception to help to reduce the flow. But the pain wise, paracetamol, ibuprofen, if it's not controlled, definitely go and see your GP for some more investigations.
wow. Thank you very much for that
Mhm.
input. Thank you so much. Yes, another question is, can you explain what prolapse is? Why do some women experience it in their early life or before turning 50?
Okay. So a prolapse is where an organ in the pelvic area is not where it should be, essentially. So in the pelvis or in the pelvic floor, there's a band of muscles that kind of are a bowl shape,
Mm,
and they hold up your bladder, it holds up your uterus, and it holds up the rectum. The rectum is your back passage, where the poop comes out from, essentially. And so if the band of muscles is weak for any particular reason, that causes a prolapse. And any one of those three organs, or in very unfortunate cases, all three of those organs can prolapse. So the most common cause of the reason of women have prolapses is uh, pressure on the pelvic floor.
mm,
Why? Because they've had pregnancy. So pregnancy, obviously, you're carrying around, 3 kilos or thereabouts for for a while. So that's very, especially if you have multiple pregnancies,
mm.
especially if you've got short spaces of time between them. That's, for most women, the first question I ask when they say, I think I've got a prolapse, is, have you had any children? If so, how many? Um, the next thing is obesity. So carrying on a bit too much weight in your abdomen can put pressure on that pelvic floor. Having problems like constipation, that can, especially for what we call rectal prolapses, that can cause it. So again, pressure in the back passage when you're not pooing as often because you're carrying that poop. There's a lot of pressure building up that can cause it. Then other things like lung problems, if you've got COPD or you're coughing a lot for whatever reason, if you've got a lung problem, that puts a lot of strain and pressure on the pelvic floor. So those tend to be the main causes that women have prolapses. And ideally, you can have all of this and still not have a prolapse. You can have those conditions. You could have had 10 kids. You
Mm,
can try and prevent them by encouraging women to do pelvic floor exercises. So most women, once you've had your baby, you go to your GP for your 6 to 8 week check. We should be asking you, are you doing your pelvic floor exercises? Because we know the pelvic floor has gone through a lot. Pregnancy itself, whether you've had a C-section or a vaginal delivery, will weaken your pelvic floor. More so if you've had a vaginal delivery, because you're having to push and strain and things are stretching quite a lot.
mm.
So doing pelvic floor exercises is a really good way to try and stop you from having that. So every time, even whilst you're pregnant or after the pregnancy, whenever you remember, you should be doing this ideally 3 times a day. And you're doing long squeezes and bursts of short squeezes to be helping with that. And I could be sitting here right now doing my pelvic floor exercises, and nobody knows. They're not strenuous to do. You just got to remember to keep doing them. So women under 50, it's almost always childbirth or obesity that's caused it. Obviously, there can be other problems, like if you've got large fibroids that are pushing pressure in the pelvic floor again, things like that. Or, unfortunately, things like tumours can also contribute to that. But that tends to be why women have prolapses.
So apart from the floor exercise, is that the only option to fix it? Is there a medication or surgery to fix prolapses?
So you can ideally have pelvic floor exercises to strengthen the muscles.
Mm-hmm.
If it's a vaginal prolapse, we can put in pessaries, which is like a small bit of plastic. We put it into the vagina to hold things up a little bit.
Mm-hmm.
So that's another option. And then surgery would be the final one to help with that. So if you really didn't want to have surgery and you were managing okay with having something like a pessary, then we would say probably have that. But yes, it's pelvic floor exercises, pessaries, which is a bit of plastic to hold things back up, or surgery to try and treat it. Those are the three main options. There's not really a medication for prolapse itself.
Mm-hmm.
When people have, some of the symptoms of prolapse that you can have is leaking urine, um, problems with passing stools. So the medication would be to soften the stools, for example, to reduce the pressure on the pelvic floor. And other medication we can give for bladder problems, but specifically for that prolapse, there's not a specific tablet to strengthen the muscle of the pelvis.
Well, thank you very much. It's a lot to take.
Mm.
Yeah, that's good. Thank you very much. So, what are the causes of diabetes? Is it curable? I know diabetes is a wider, broader things that people deal with.
Mm.
And some people say, yes, people that have diabetes, they say maybe it's because they have it, it's genetic or something. But some people, their grandparents have it, but they don't have it. So, what are the main cause of diabetes, and is it curable?
Yeah,
Yeah.
so diabetes is generally split into two types. Type 1 diabetes
Diabetes.
is solely, it's not preventable. There's nothing you can do. You're unfortunate, something has happened to the pancreas, or the part of the body that produces the insulin, and your body doesn't respond to that. That tends to happen in childhood. So most people, before the age of 20, they would know that they're diabetic. And that's thankfully is not the most common form of diabetes. The
Mm.
most common form of diabetes is type 2 diabetes, which tends to have other things that can contribute to it. Most, especially in this day and age, it's obesity, it's our diet, and it does have genetic components. So, for example, you're more likely to be diabetic if your grandma, your father was, that there is a genetic component to it. But most of the time, it is lifestyle factors. So, eating well, exercising, being a good weight tends to be the things that you can do to try and stop yourself from being diabetes. If it's gotten to a point where we are needing to treat it, or it's treatable with medication, whether that's tablets or insulin. But ideally, we can try and reverse the changes early on if we get in quickly, and then try and maintain it with diet. So, the fact that you're diabetic doesn't mean you have to take tablets. You can have diet controlled diabetes, which means you just got to be careful with what you're eating, lose weight, control your diet. Those tend to be the two most important things you can do to help. But we know that as time goes on, people's insulin sensitivity, insulin is that hormone that brings the sugars down, can decrease. So you might need medication for it.
Thank you so much. So, people with diabetes, are they going to live it? Are they living with it for the rest of their life, or will they live with it with the rest of their life, or is it curable at some stage?
Yeah. So what we don't. I want to be careful with the word cure.
Oh, yeah.
We can put
Okay.
the diabetes into remission, which is that you're not having, your sugars are pretty much normal, and you're not needing any medication, you're controlling it. Because as soon as you come out of those factors, so for example, most people that we diagnose with diabetes, they're overweight, their diet isn't particularly good. And when I say it's not particularly good, I mean it contains a lot of carbohydrates. Carbohydrates, which is things like potatoes, rice, etc., they eventually converted back into sugar. So when your diet is not well maintained, when your weight is not well maintained, it increases your risk of you having diabetes. We can put it into remission if you reverse those factors. So if you lose a lot of weight, we know it does wonders. And if you are very strict with the amount of sugar, which is carbohydrates that you take, then you can also put your diabetes into remission.
Thank you very much. Yeah, before I go to the next question, which I think is the final one, What advice will you give to women that avoid to go for screening? Because now they want women to go for breast screening because they said it's good for them. And some women say, you know what, I don't have to go for my breast screening. So
Mhm.
what advice will you give to women avoiding
Breast
breast?
screening.
Yeah.
Okay. So everybody is always fine until they're not.
I like the way you said that.
And it's true. You're fine until all of a sudden somebody tells you that you're not. And if you don't find out, if we don't go and look, then most people might not know. And what we don't want is for it something to get to a later stage where it's not treatable anymore, and then you find out that something is wrong. So screening in general is for the healthy population. So whether that's cervical screening with the smear test, or or the mammograms for the breast screening programs, ideally we look at everybody in the population who is healthy, but because of their age or sex or whatever it is, you're at higher risk of having a certain condition. So breast cancer in this regard. If you are a woman over, I think it's about age 50 now that our screening program is, you should be doing, every woman in general should be doing regular breast exam. You should know what your breasts feel like. You should be doing that at least once a week or so, all throughout your cycle, because your breast tissue changes in response to your hormone levels. And you should know what feels normal for you. So if you are regularly checking your breasts, you can only detect something when it's the size of your fingers.
Yeah.
So if it's the size of, if you have very large breasts, you might even miss it completely. So I would say, please go for your breast screening, because it's uncomfortable. You know, they put an X-ray there, but it's not painful. It's a bit of discomfort to save your life potentially. Even if you say nobody in my family has ever had breast cancer, unfortunately, you could be that first person. And we never pray that anybody is that person, but
That
these
is
things
why we say
happen.
people say God forbid because
Yeah, exactly. God forbid. But also, God has given us wisdom to do the things to look after ourselves. We are stewards. Ultimately, our bodies are His temple, and we should be doing everything we can to look after our bodies. So that means if someone says, "Oh, come, we'll do a quick swab to check for HPV virus, or a mammogram to check for breast cancer," then go ahead and do it. This is why God has given us wisdom, so that, there's certain things I think we can pray for, but also some
yeah,
things
it's
you
true.
don't need to be doing prayer and fasting for.
So, as a doctor, do you advise? Because I know in UK they give the letter. You get the letter once you're 50 to come and do
Mhm.
it. So, is it advisable for younger people that have big breasts to go and do the mammogram?
So the screening program only allows women of a certain age to go.
Mm-hmm.
The reason I started off by saying every woman should be checking their breasts regularly is so that you know what is normal for you. Breast
Mm-hmm.
cancer is not impossible to have under the age of 50, and unfortunately women do have it, especially if it's in the family. So if it's in the family, you need to go and ask your GP whether or not you are eligible for having regular mammograms before that the national screening program comes into play. But you should be doing regular breast exams so you know what is normal for you. Thinking about the other things that you take, whether it's the pill for hormones and things like that, that can also affect your risk of having it. But we wouldn't do a mammogram unless you fitted a certain criteria. And if you are worried for any reason, always go and ask your GP and just say, this is the reason why I'm worried. You can even ask them to do a breast exam for you if you want some more reassurance. But if you're thinking there's something that might be brewing, it's always better to be safe than sorry. For women under the age of 25 or 30, we can do an ultrasound. Over that kind of age, then we tend to do mammograms.
Okay, that's fine. That's good. Anyway, they normally tell people to do to examine their breast themselves. So
Absolutely.
when they are
Yeah,
bathing, they can do that themselves. So they can,
exactly.
yeah,
Yeah.
get data. Anyway, thank you so much for that input. Yeah, the odd question for today is, how can someone avoid hypertension and high blood
High
pressure?
blood
Sorry,
pressure, yeah.
high
Or
blood pressure.
hypertension, yeah. Or,
Yeah.
or high blood pressure. They're
Or
the
high blood
same thing.
pressure, because there's
Um,
so much young ladies now, yeah, even before they turn 50, 40, 30s, they have this hypertension, they have high blood pressure. So what's the cause?
So hypertension or high blood pressure tends to be caused because of hardening of the blood vessels that take blood to different parts of the body. And a lot of things can cause high blood pressure. Stress. We seem to be living in a very high stress environment now, but the management of stress can contribute to hypertension. But like the other things that I've mentioned again in this show, being obese, carrying too much weight, smoking, alcohol. Also, having foods that are high in salt can increase your risk of having high blood pressure. And I know us Africans tend to we like our seasoning, we like
Oh, God,
we
tell
like salt and things. But those are very easy things. So when people come and they say, I check their blood pressure, I'm asking them, what are you eating? What is your diet like? Are you exercising? What is your weight like? How stressed are you? What kind of job are you doing? Are you stressed? Are you worrying all the time? You're not sleeping well, you're not eating well. All these kind of things can really affect your blood pressure. Unfortunately, for young people, especially under the age of kind of 40, if you're having high blood pressure, we do know that there are certain medical conditions that can cause it. So if you are in that category, your GP should be doing a range of other blood tests and potentially referring you on to a specialist for further investigations as to why you have it. Because it can be problems to do with the adrenal glands, it can be to do with the brain, there can be lots of different things that causes hypertension in young people. And when I say young, I mean in that kind of 30 to 40 age range. But the people I've tended to see in my own practice now that are 30 plus and having hypertension, they tend to have obesity alongside it. That tends to be the prevailing cause now because unfortunately our society is getting bigger overall.
Thank you so much. So what general advice can you give to women? Because I know we're talking about women's health issues.
Yeah.
What general advice can you give to women to look after themselves? Because we can see that men, they only have limited things. I'm not saying they don't have their own issue, but
No, of
compared
course,
to
yeah,
women,
yeah.
the women one is so broad. And the younger ones growing up in school, they eat anything, they drink anything. You're going to be wondering that you guys are not really looking after your health. And these are the things that pile up, you see, till they till they grow up and get to that adulthood, and things
Yeah.
start coming out. So what general advice can you give to both old and young
Yeah.
women? Yeah.
I think the most important thing is to know your body and to look after it as a temple. When I say know your body, because of women especially, we have this fluctuation of hormones every month. And then once you hit menopause, that's another big reset. So find out what is normal for you. So as soon as something is abnormal, you can flag it up to your doctor and say that this is not me. There's something not quite right here. But if you're not paying attention to yourself, you won't necessarily know quickly enough when something isn't right. And the other thing is to look after yourself generally. So eat well from the beginning. Drink plenty of water, sleep well. You will be amazed at the difference that a good night's sleep makes. That means you've got to put your phone away in a box somewhere so you're not looking at it, to make sure that you're getting good enough sleep. That's extremely
The phone
important.
is another issue.
It's another issue, but it's probably, when people come and they say I can't sleep now, I'm thinking, where is your phone when you're telling me you can't sleep? It's it's a big cause of that. But yeah, eat well, sleep well, and move your bodies. As women, we tend to have lower exercise rates than men do. We don't move as much. We get bogged down in thinking about housework, we're planning this, we're doing that. So we're not moving our bodies as much, and that can lead to lots of other problems, joint problems, back problems, but also in our general physical health. So moving is also really important as well. Getting some form of exercise, keep your weight down.
Thank you so much. So women, you've heard what Dr. Ebun said, that we need to look ourselves, we need to eat well, we need to sleep well. What about people that have insomnia?
Oh, insomnia is a very different
Thing entirely.
yeah, it's an entirely different thing. So we could potentially talk about that.
How about that? So women, the doctor have said it all. We've covered quite a few stuff, which I believe that is going to encourage us as well as a woman to look after ourselves, because our body is a vehicle anyway. Because without good health, we can't even go to work. Without good health, we can't serve God. Without good health, we can't look after our children. So women, we need to really look after ourselves, eat well, sleep well. We don't want hypertension. We don't want to die young. We want to live long life. That's what God has promised us. So, Dr. Ebun, thank you so much for your time this wonderful afternoon. I'm really grateful that we discussed this, and I hope to see you some other time to discuss
Thank you so much.
more stuff. Thank you for joining me.
Thank you. Thank you very much for having me. God bless.
You're welcome.